Hello students, welcome to this lecture. Principal investigator and sub-investigator. Delegation log tasks. But before that, meet a friend first. Meet sub-investigator SI Dr. Doolittle.
Hi, I'm Dr. Doolittle.
Tell me something about your background, doctor.
Well, I was educated at Harvard and have so much experience. But here in Australia, for some other reason, I had to work under Dr. Magnum PI. I am a SI. But one of these days I'm gonna fill his shoes. Lord only knows. I do most of his work for him. I assess patients, treat them for adverse events, make medical decisions, take informed consent, basically everything. And Lord Almighty, if Magnum goes on leave, I get to be acting PI. Fingers crossed now.
Let's look at each of the tasks assigned to PI and SI.
The first one is Magnum PI. So he's the principal investigator. He can do anything. He's the principal investigator. So you can see he's assigned task A, B, C, D, E, F, G, H, I, right? And if you look at the third row, sub-investigator Dr. Doolittle, he is assigned exactly the same list of tasks. So let's see what these tasks are. Task A, B, C, D, E, F, G, H, I are assigned only to PI or SI. That means a doctor. It has to be a medical doctor to do those tasks. So task A means taking informed consent, right? So right here in Australia, taking informed consent can only be done by a medical professional. But I'm aware that in other countries, other people can also do it, like nurses and so forth. So in that case, that should be recorded in the delegation log, right? But in this case, it should only be done by a medical professional. And then task B is physical examination. That means examining the patient for medical conditions, whether their lung capacity is proper, whether their heart function is proper, and so forth. And then C is inclusion and exclusion criteria, assessment, right? And written confirmation. That means for each trial, when the patient first comes in, there is a list of inclusion and exclusion criteria. That means what are the properties that the patient needs to have in order to enroll in the study, and what are the properties that they shouldn't have. Those are the exclusion criteria. We'll go through this in depth in the protocol section, but for right now, just remember that inclusion and exclusion criteria confirmation is done by a medical doctor, either PI or SI. So that's task C. D is assessment of patient continuation. So in the course of the study, the patient might come up with new conditions, right? And the inclusion exclusion criteria might change. So the PI or the SI assess whether the patient can continue in the study, right? And task E is dose adjustments. The drug dose will be adjusted according to the patient's response or any adverse event they might have. According to the protocol, if they have a severe adverse event, the dose can be reduced. But this is only done by a medical professional because they know about the medical condition, they understand the medical condition. So it can only be done by a medical doctor, either principal investigator or sub-investigator. So in this case, either PI Magnum or sub-investigator, Dr. Doolittle. And task F is sign off medical data queries. So we'll explain this later. When the site enters the data, it goes into a central repository, and then the medical monitor will ask questions, medical query. And those medical queries should only be answered by the PI or the sub-investigator. Task H, exam result assessment. That means lab results. So when the patient's blood go to the lab to do lab analysis, and then the lab report comes back, right? And lab results are recorded there, and the range is given. For example, ALT, AST, the liver enzyme. So it might be above the proper range, but it is the PI or the SI's responsibility to evaluate whether it's medically significant. So they evaluate the lab result and they sign off on the lab report whether it's non-clinically significant or clinically significant. So exam result assessment, and task H is breaking the blind. So we'll talk about this later. So usually clinical trials are double blinded. That means neither the doctor or the patient knows which drug, whether it's the test drug or the placebo they were given. But during the course of the trial, the doctor may need to know exactly which drug was given. If the patient comes with a severe adverse event, the doctor has to immediately know what drug was given, because depending on that, he can change his course of action and he can get advice from the sponsor about what to do. Right, so he should be immediately be able to break the blind. That means double blind. He should be able to break the blind and reveal to himself what drug was given to the patient. So that means breaking the blind. There's a technical method that we use to do this. We will explain that in drug accountability. But for now, just remember that it's only the principal investigator or the sub-investigator who are able to break the blind. The last one is I is essay reporting. That means serious adverse event reporting. That means we'll talk about this later. What is a serious adverse event? That means it either leads to death or hospitalization, and there are so many other things we'll explain to you later. But in case SA happens, the PI or SI has to report it, right? So in some cases, the nurse will prepare the SA report, but the PI and the SI have to sign off because they are responsible for reporting, the actual reporting, SA reporting. SA report goes to the sponsor and the ethics committee. So that task is also assigned to the PI or SI, either PI magnum or PI or a sub-investigator who do little. So that brings to the end of the task for the PI and SI. Then we'll look at the task for the other staff.